Hello everyone, welcome to Becoming Dentist. Today we shall be learning about the introduction to dental anatomy. Now, in your journey of becoming a dentist, we shall be learning about the basic anatomy of all the teeth. And to learn the anatomy of all the teeth, we shall be learning about some of the basic concepts and terminologies in this lecture. So, this lecture will be divided into 7 main topics, that is the type of dentition, the formula of mammalian teeth, parts of tooth, surfaces, landmarks and division into thirds. To make this simpler, we shall be learning about only 4 topics in today's video in part 1, and in part 2 we shall be covering the other 3 topics. So, starting with the type of dentition. Now, from birth to the death, a person has 2 sets of teeth during their entire lifetime. Now, which are these 2 sets of teeth? So, the first set of teeth is the primary teeth. This is the teeth that the child gets after their birth. The first set of teeth after birth is called as the primary dentition. Primary means first, and then after these primary teeth have been shed off, the second set of teeth that the child will get will be the permanent teeth. Now, these teeth will stay throughout the life cycle or the lifetime of the child till the death or till the teeth fall off for some other reasons. Now, the primary or deciduous dentition will start at 6 months up to 6 years of age. Now, 6 years is the time when the first permanent tooth will erupt. These teeth are also called as milk teeth. You must be familiar with the term milk teeth. These are named so because of the milk-like white appearance of the teeth. Then we have the permanent or the succedaneous dentition. Now, what is succedaneous? Succedaneous means to succeed after another tooth. So, the tooth which will appear in the place of deciduous or primary dentition are called succedaneous dentition or the succedaneous tooth. Now, these are the tooth which will appear after the primary dentition. So, it is the second set of teeth. Now, when the permanent dentition appears at the age of 6 years, the first permanent teeth appears at the age of 6 years, its emergence will mark the beginning of the mixed phase. What is the mixed phase? The mixed or the transition phase is the phase where both the primary and the permanent teeth are present in the oral cavity, consisting of both primary and permanent teeth. The span of the transition or the mixed period is from 6 to 12 years of age. Now, this phase will end when all the deciduous teeth have been shed off. When all the primary or the deciduous teeth have been shed off from the oral cavity and when only permanent teeth remain, the transition phase will be completed. Now, it is also sometimes referred to as the ugly duckling phase. Why is it so? Because during the transition phase, the oral cavity of the child will have primary teeth as well as the permanent teeth. Now, these two teeth will differ in their appearance a little bit, say the shape, the color, which will give the child an ugly appearance like a new duckling. Now, based on the presence of teeth in different arches, that the maxillary arch and the mandibular arch, the teeth are of two types, the maxillary teeth and the mandibular teeth. Now, suppose this is the face of a person. The teeth which will be present in the maxillary arch or the upper jaw in the maxillary bone are called as the maxillary teeth, and the teeth which will be present in the lower jaw or the mandible bone, mandibular arch, are called as the mandibular teeth. Moving forward, we have the formula of mammalian teeth. Now, if we want to represent the dentition of a person, the sequence in which we will write this or the formula in which we will write these teeth are called as the formula of mammalian teeth. To understand these, first we must learn these 4 terminologies. Here, whenever we write I, we shall be indicating to incisors. Whenever we use the word C, we will be referring to canines. Same, P for premolars and M for molars. Now, let us take a look at the arches of teeth. Here, this is the maxillary arch. This is the mandibular arch. Now this is the right side and this is the left side. So as you can see over here, we have the incisors, the canines, the premolars and the 3 molars. Similarly, on the lower arch we have the incisors, the canine, 2 premolars and 3 molars. Now as you can see, on the right side and the left side we have the same type of dentition. So whenever we write the formula of dentition, we will be using only one arch of each jaw. So we will be using upper right arch and the lower right arch, as both the right and the left side of individual arches are similar. So for primary or deciduous teeth, let us suppose we will take the right side. So we have the incisors, 2 incisors on the upper side and 2 on the lower side. So we will write it as I, 2 maxillary incisors by 2 mandibular incisors. Now for canine, we have 1 maxillary canine and 1 mandibular canine. So we will write canine 1 maxillary by 1 mandibular. Now primary dentition do not have premolars. It is very important to remember that primary dentition do not consist of premolars, nor do they have the third molar or the wisdom tooth. So for molars, we will write 2 maxillary molars by 2 mandibular molars. So the final formula will be incisors, maxillary 2, mandibular 2, canine, maxillary 1 by mandibular 1 and molar, maxillary 2 and mandibular 2, giving us a total of 10 teeth on the right side. So if there are 10 teeth on the right side, there will be 10 teeth on the left side as well. So the total number of teeth in primary dentition will be 20. Similarly, for permanent teeth, we have the central incisor, lateral incisor. So incisor, 2 maxillary, 2 mandibular, the maxillary canine, the mandibular canine. So canine, maxillary, mandibular, 2 premolars. Now in permanent dentition, we will have premolars, that is 2 maxillary, 2 mandibular, and we will have molars, 3 molars, the first molar, the second molar and the third molar. So we will have molar, 3 maxillary and 3 mandibular. So the final formula will be incisors, 2 maxillary, 2 mandibular, canine, 1 maxillary, 1 mandibular, premolar, 2 maxillary, 2 mandibular, molars, 3 maxillary and 3 mandibular, giving us a total of 16 teeth on the right side of both the arches. Similarly, there will be 16 teeth on the left side of the arch, giving us a total of 32 permanent teeth. Now, moving on, we have the parts of a tooth. So basically, a tooth will have majorly 2 parts. The part that is the crown and the root, and part between that, the line between that, is the neck. Now, whenever the tooth is present in the oral cavity, it will be embedded into the alveolar bone, that is the maxillary bone or the mandibular bone. Now suppose this is the bone. So the part which is inside the bone, this part, it is called as the root, and the part which is above the bone, it is called as the crown. Now, root, as you can see in this picture, either can have 1 root, it can have 2 root or 3 roots, depending on the teeth. 1 root is mainly in the incisors and the canines. 2 root are present mainly in the maxillary, first premolar and the mandibular molars, and 3 root are seen in the maxillary molars. 1 root are also seen in all the premolars except the maxillary first premolar, which has 2 roots. Now, when the root divides over here, this area is called as the furcation area. The area is called as the furcation areas. Now, if the root is dividing into 2, it will be called as bifurcation, that is division into 2. And if it divides into 3, this is called as the trifurcation, that is division into 3. Now, talking about the part which is not embedded into the alveolar bone, that is the crown. Now the crown can either is either clinical crown or anatomical crown. Now in the oral cavity, as you can see, your teeth are covered by gums. Am I right? The teeth are covered by gums. Now some part of the crown is covered by gums as well. Now this part which is not covered by gums is the only part which we can actually see in the oral cavity. So whenever you smile and see the tooth you will be seeing will not be the entire tooth, but the only tooth which is not covered by gums or gingiva. This is called as the clinical crown, the crown not covered by gums. And the entire crown which is covered by gums and not covered by gums as well. It is called as the anatomical crown. Now, if we take the cross section of a tooth, now see if this is the tooth, and if we cut it from here like this, if we cut it from over here, if we take a section, this is the inside of a tooth. Now see, as you can see, this is the alveolar bone into which the tooth is embedded. This is the anatomical crown. This is the root, and this is the area of bifurcation of root. Now, the innermost part of the tooth, which you can see here in pink color, this is called as the pulp of the tooth. Here it is the pulp of the tooth, which is the soft tissue of the tooth. Now in the crown, the pulp which is present in the crown is called as the coronal pulp, and in the root it is called as the radicular pulp. Now here the area which you can see, this is called as the pulp chamber. In the crown we have the pulp chamber, in the root we have the pulp canals like this, and the extension into the cusps over here is called as the pulp horns. Why? Because see, as you can see, it is giving the appearance of a horn. Now sometimes extra canals can also be present extending from the pulp. These are called as the accessory canals. The accessory canals. Now outside of the pulp, the yellow structure that you can see is called as the dentine. Outside the pulp we have the dentine, which is also present in the crown as well as the root. Now outside the dentine, as you can see in the crown, there is the white structure. Here this white structure is called as the enamel. Now enamel covers only the crown. The entire crown, anatomical crown, is covered by the enamel. And the root, as you can see this light yellow structure outside of the dentine, it is called as the cementum, which covers the entire root outside of the dentine. Now the junction here where the enamel and cementum meet over here, as you can see, is called as the cemento-enamel junction. Cemento-enamel junction or the cervical line. Here, as you can see, this is the cervical line, and this is also where the cementum meets the enamel. Now, here the alveolar bone is connected to the tooth by various fibers or ligaments called as the periodontal ligament. These red fibers which you can see here, which connects the tooth to the bone, are called as periodontal ligaments. So these are basically all the parts of the tooth, the outside and the inside. Now moving on to the surfaces of the tooth. Now basically in the anterior teeth, the anterior teeth comprising incisors and canines, they have total 4 surfaces and 1 ridge. Now which are these 4 surfaces? First of all, we have the labial surface. Labial surface, labial means lips. So the surface which is towards the lips here, this surface which is facing towards the lip, when you smile and see the tooth, that surface which you will be seeing will be the labial surface, the lingual surface. Now lingual, as you know, lingual or in the anterior teeth we can also call this the palatal surface. This is the surface which is facing the tongue or the palate. In the anterior maxillary teeth, they will be facing the palate, and the mandibular teeth will be facing the tongue. So it is called as the lingual surface or the palatal surface. Now, Here, if this is the face of a person, then the line bisecting the face into two halves, the right half and the left half, is called as the median line. This line is called as the median line. So, the surface of the tooth which is facing towards the median line, this surface and this surface which is marked by pink over here, these surfaces facing towards the median line. As you can see, these are called as the mesial surfaces, and the surfaces facing away from the median line. As you can see, this surface is towards the median line, this surface is away from median line. The surface away from median line is called as the distal surface. Same over here, this surface is facing towards the median line, so mesial surface. This is away from the median line, so the distal surface. In the incisors, as you can see, the mesial surface of the maxillary central incisor of the left side will face the mesial surface of the maxillary right incisor. But the distal surface of the maxillary central incisor will face the mesial surface of the maxillary lateral incisor. Now the ridge. Ridge, here we are talking about the incisal ridge over here. For the posterior teeth also we have five surfaces. The buccal surface, the surface facing the cheeks, lingual surface, surface facing the tongue, the mesial surface, surface facing towards the median line, and the distal surface, the surface facing away from the median line. The other surface present here is the occlusal surface. The occlusal surface of the premolars and the molars, that is the posterior teeth, which come in contact with those of the opposite jaw. Now, if this is one tooth of the maxillary arch and this is the other tooth of the mandibular arch, so this surface will come in contact with this surface, correct? So both of these surfaces, this surface and this surface, are called as the occlusal surface. The surface which come in contact with one another are called as the occlusal surface. That is it for today's video. Thank you for watching till the end. Please do like the video, share it and subscribe and keep learning. Thank you.